50,000 years ago, deep in the frozen limestone caverns of northern Spain, a Neanderthal hunter collapsed from an agonizing dental abscess. In his world of sub-zero blizzards and predatory cave bears, an infection like this was a death sentence. Yet, when modern geneticists scraped the calcified dental plaque from his fossilized jawbone, they didn't just find remnants of meat. They found traces of poplar bark containing natural salicylic acid, the core active ingredient in modern aspirin. Even more shocking, they discovered genetic material from Penicillin mold. 45 millennia before Alexander Fleming supposedly discovered antibiotics. For centuries, mainstream history painted prehistoric humans as brutish, unthinking survivors who lived short, violent lives dictated entirely by brute force. We assumed that medicine began in ancient Egypt, Greece, or Mesopotamia. But cutting-edge paleogenomics is dismantling that myth. Long before written language, before agriculture, and before the first cities rose, Pleistocene hunter-gatherers had engineered an astonishingly sophisticated botanical pharmacopoeia. The turning point in our understanding occurred at the El Sidrón cave in Asturias, Spain. Researchers analyzed ancient DNA preserved inside dental calculus, fossilized tartar that acts as a microscopic time capsule. Unlike healthy members of the clan who consumed wild sheep and forest mushrooms, the individual suffering from the dental abscess and an intestinal parasite had consumed medicinal flora exclusively. He was not eating for nutrition, he was dosing himself with targeted remedies. Similar revelations emerged thousands of miles away in the Zagros Mountains of Iraqi Kurdistan, at the famous Shanidar Cave. Inside Shanidar 4, a 60,000-year-old Neanderthal burial site, paleopalynologists found dense clusters of wildflower pollens, yarrow, cornflower, groundsel, and grape hyacinth. While initial debate centered on whether this was a ritual floral tribute, modern ethnobotanists recognized these exact plants as potent anti-inflammatories, diuretics, and wound-healing astringents. Surviving the last glacial maximum was not just about hunting mammoths and keeping fires lit. It was a biochemical arms race against lethal pathogens, deep tissue trauma, and unforgiving cold. Welcome to the lost world of Ice Age medicine, where survival depended on knowing which stem could stop a hemorrhage, which bark could break a fever, and which fungus could purge a killing parasite. The Pleistocene flora of Eurasia and North America was harsh, rugged, and densely packed with secondary plant metabolites. To survive freezing winds and intense UV radiation reflected off ice sheets, Arctic plants developed high concentrations of protective chemical compounds, phenolics, terpenes, and alkaloids. Ice Age healers learned to weaponize these plant defenses to treat human ailments. Chief among their botanical arsenal was the willow tree, *salix*, and poplar, *populus*. The inner bark of these trees contains salicin, a bitter glucoside. When ingested or brewed into decoctions, human gut enzymes metabolize salicin into salicylic acid. It inhibits cyclooxygenase enzymes, dramatically reducing prostaglandin synthesis. To an Ice Age hunter suffering from debilitating arthritis or fever, chewing willow bark provided the exact biochemical relief as taking an over-the-counter Bayer tablet today. But fever was only half the battle. In a world where hunting woolly rhinos and steppe bison caused horrific lacerations, blood loss was an immediate killer. Enter Achillea millefolium, commonly known as yarrow. Found widespread across tundra valleys, yarrow contains achillein, an alkaloid that drastically accelerates blood clotting, alongside anti-inflammatory flavonoids and azulene. Hunters carried crushed dried yarrow leaves in animal hide pouches. When an arterial or venous gash occurred during a hunt, healers packed the wound directly with yarrow poultices. The tannins in the leaves precipitated proteins on the surface of the exposed tissue, forming an instant protective coagulated scab while its antimicrobial volatile oils suppressed anaerobic bacteria. To seal deep puncture wounds against freezing winds and putrefactive bacteria, prehistoric shamans turned to coniferous resin. Specifically Scots pine, Pinus sylvestris and Siberian fir. Pine pitch is rich in alpha and beta-pinene, potent terpenes with broad-spectrum bactericidal, antifungal, and antiviral properties. When heated gently over campfires, pine resin melted into a sterile, malleable biological sealant. Applied directly over lacerations and compound fractures, it cooled into a waterproof, antiseptic barrier that prevented frostbite and gangrene while locking herbal poultices tight against damaged tissue. Furthermore, healers utilized marshmallow root, Althea officinalis and coltsfoot, Tussilago farfara to combat chronic respiratory infections caused by living in smoky, unventilated caves. The high mucilage content coated inflamed mucous membranes, soothing bronchial spasms and allowing hunters to survive long, damp winters without suffocating from pneumonia. Beyond everyday cuts and fevers, Pleistocene life presented existential medical crises, horrific blunt force skull trauma from animal charges, internal parasitic infestations from raw carnivore meat, and deep tissue necrosis. Skeletal remains from Upper Paleolithic sites reveal astonishing evidence of successful primitive cranial surgery, known as trepanation. Anthropologists have excavated skulls in modern-day France, Ukraine, and Siberia featuring clean, circular burr holes scraped into the parietal bone with flint blades. Incredibly, extensive bone remodeling around the edges proves that over 70% of these patients survived the procedure, often living for decades afterward. In a sterile modern hospital, cranial surgery is dangerous. In a damp Pleistocene cave, survival without potent plant antiseptics would have been biologically impossible. The secret weapon of the Ice Age surgeon was sphagnum moss. Growing in vast blankets across subarctic peat bogs, sphagnum is nature's most extraordinary dressing material. Its cellular structure allows it to absorb more than 20 times its dry weight in fluids, drawing infectious exudate away from open cranial and orthopedic wounds far more effectively than cotton. But sphagnum's power goes beyond absorption. Its cell walls contain sphagnum, a complex pectin-like polysaccharide that binds essential metal ions, creating an intensely acidic environment with a pH between 3.5 and 4.0. In this acidic microclimate, deadly pathogens like Staphylococcus aureus and Pseudomonas cannot survive or replicate. Sphagnum was a living, sterile surgical sponge that prevented postoperative sepsis. Simultaneously, healers waged constant warfare against internal parasites. Consuming mammoth, horse, and bear meat exposed tribes to vicious intestinal nematodes like Trichuris trichura, whipworm. To purge these debilitating worms, healers utilized Phamatopsis betulina, the birch polypore fungus. Birch polypore produces agaric acid, a compound known for its aggressive laxative and purgative properties, alongside toxic triterpenes that induce paralysis in intestinal helminths. By preparing controlled infusions of this bracket fungus, Ice Age healers successfully expelled parasitic loads without poisoning the human host. They also used birch polypore's fibrous inner felt as sterile styptic pads to halt bleeding, and burned its dry mass as smudges to repel biting tundra mosquitoes and midges that carried vector-borne fevers. In September 1991, two German hikers in the Ötztal Alps near the Austrian-Italian border made one of the greatest archaeological discoveries in human history, Ötzi the Iceman. Preserved in alpine glacial ice for over 5,300 years with his soft tissue, clothing, and gear completely intact, Ötzi provided an unmediated window into prehistoric medical technology. When forensic scientists examined Ötzi's leather pouch, they uncovered a meticulously organized portable medicine kit. Threaded onto 2 leather cords were dried, walnut-sized pieces of Pharmacopsis specialina, birch polypore. Microscopic examination of Ötzi's colon revealed a heavy whipworm infection. He was literally carrying his personalized, prescribed antiparasitic treatment in his alpine first aid pouch at the time of his death. But the Iceman's botanical gear held even more surprises. Inside his pouches, archaeologists discovered a Nonidus obliquus, known as chaga, and Fomes fomentarius, the tinder polypore. While useful for carrying embers over freezing terrain, chemical analysis showed these fungi had been infused with resinous and herbal anti-inflammatory extracts. Ötzi's body also featured 61 distinct carbon ink tattoos, grouped along classical acupuncture meridians and concentrated over severely arthritic joints in his lumbar spine, right knee, and ankles. Archaeobotanical trace analysis suggests these tattoos were made by puncturing the skin and rubbing in powdered herbal ash, likely containing burnt willow bark and pine resin, providing localized transdermal pain management. Furthermore, in Ötzi's stomach contents, palynologists detected traces of bracken fern, Pteridium aquilinum *. While toxic in large quantities, microdoses of bracken were commonly used as an emergency vermifuge to paralyze intestinal flukes. Ice Age healers understood the fundamental rule of pharmacology millennia before Paracelsus: the dose makes the poison. This empirical understanding required generations of careful observation, oral transmission, and systematic experimentation. Healers tracked seasonal potencies, knowing that roots must be harvested in late autumn when concentrated with starches and sap, while leaves and flowers were potent only during brief subarctic summer blooms. When we look at a modern pharmacy shelf, we see sleek blister packs, sterile vials, and complex chemical nomenclature. But stripped down to their fundamental molecules, over 40% of our modern pharmaceutical catalog traces directly back to the botanical discoveries of prehistoric healers. The willow bark chewed in the freezing caves of El Sidron gave birth to acetylsalicylic acid, the world's most widely used cardiac and anti-inflammatory drug. The antimicrobial compounds in subarctic bogs paved the way for modern antiseptic wound management. And the study of Paleolithic fungal metabolites continues to inspire next-generation antifungal and antiparasitic therapeutics. The survival of our species was never guaranteed. We did not conquer the grueling Ice Age through muscle and flint alone. We survived because our ancestors were brilliant biochemists without test tubes, clinical researchers without laboratories, and healers who looked into the frozen tundra and saw a vibrant, life-saving pharmacy. As modern science faces emerging antibiotic resistance and searches for novel organic compounds, researchers are turning their gaze backward, decoding ancient dental calculus, excavating frozen burials, and consulting the forgotten botanical wisdom of the Ice Age. If you found this journey into prehistoric science fascinating, hit that like button and subscribe for more deep dives into the untold chapters of human history. Let us know in the comments below, which prehistoric remedy surprised you the most. Thank you for watching, and see you in the next expedition.